Navigating healthcare and insurance options can be overwhelming, especially for seniors and those managing chronic conditions. Today, we are joined by Doreen Dann, owner of DLD Healthcare Insurance Services, and she is a longtime healthcare executive as well, with decades of experience in both hospital leadership and insurance consulting. Doreen is here to share insights on how to stay informed and avoid costly mistakes, and of course, to prepare ahead for the Medicare and prescription drug coverage windows. Hi, Doreen.
Hi, how are you?
I'm doing great. How are you today?
Doing well. Thank you.
Doreen, let's talk about what inspired you to start your business.
Oh, thank you. Actually, it was a part of my own personal journey. I am a widow, and I went to Social Security to assume spousal benefits. And in doing so, there was an error made in my application. And though I was working full time, they enrolled me in Part B, which was not a service I needed. And so it took me 9 months to get that appealed. And at the time, I was applying for a Medicare Advantage plan, and I got enrolled because I, quote, had Part B. And then I was quickly disenrolled because the appeal worked. And they disenrolled me. So it's my own journey that said, gosh, if I'm a registered nurse and I've worked in healthcare and I'm having this kind of experience, I need to understand this. So I went and got licensed and have been doing it since 2018.
Wow. So I know you've had a remarkable career in healthcare leadership. What experience stands out as something that's was the most impactful or eye-opening for you?
Actually, again, it relates to my husband. Unfortunately, he was in a car accident close to our home, and he entered the healthcare system, critical care, as a John Doe. And he lived for 8 days, and we had to exercise his advanced directives. But during that time, my faith, my friends assisted me. But the most inspiring was that I created his story for the caregivers to read every day, taking care of him, knowing that his hearing was the last sense before he would pass. And my hospital then adopted that as a practice for all of our patients in our rehab and critical care and cancer units. And then the Joint Commission adopted it for hospitals nationwide. So that was probably my most inspiring experience, to see something so positive come out of a really tough situation.
You're right. I think sometimes it's so hard because choosing insurances and dealing with healthcare can feel so dehumanizing when it's such a human experience. So to have somebody who's gone through it, who kind of knows the ins and outs and has that personal connection with, really helps make a decision a lot better.
Correct. You're so correct. Yeah.
So for, we're a little ways away from the Medicare enrollment, window for later this year, but what should we be keeping in mind as we kind of creep closer towards it?
Well, the most important thing is understanding the basics of Medicare. If you're aging into Medicare, there's a lot for you to learn in terms of enrolling in Medicare Part A, B, and D for drugs. Medicare also has Part C that bundles it all into these Medicare Advantage prescription drug plans. So personally, I believe having an agent is critical for people as they navigate, because choosing the right healthcare plan based on one's healthcare needs and prescriptions is critically important. And many plans are rated based on community or age ratings. Your agent will know these things, and though you can do it through Medicare.gov, it's so helpful to have an agent assist. And that's what I have found working with clients, mainly word of mouth marketing, but it's just being able to know their story, what their needs are, and to help them understand the basics of Medicare and what health plan to consider.
All right, Doreen, if somebody is so happy hearing you say all this right now and they're like, well, I need a Doreen in my life, I need somebody who cares and understands and gets that, how do they get a hold of you?
Oh, thanks so much for asking. I have a personal webpage, and it is www.dldhealthcareconsulting.com. and they could go there and register, and I'd be glad to send them information.
Thank you so much, Doreen. It was a pleasure to talk to you today.
Thank you.